The Noguchi Memorial Institute for Medical Research, a constituent of the College of Health Sciences, University of Ghana, has collaborated with the Japan International Cooperation Agency, JICA, to train 15 healthcare professionals from 10 West and Central African countries in modern laboratory technology to enhance their skills in combating infectious diseases. The participating countries that benefited from the 8-week training are Benin, Burkina Faso, Cote d'Ivoire, Gabon, Ghana, Guinea, Liberia, Nigeria, Sierra Leone, and the Democratic Republic of Congo. The course, which is funded by JICA, was implemented by the Noguchi Memorial Institute for Medical Research. The Chief Senior Representative of JICA, Mr. Monita Katsumura, in his address at the closing ceremony said the government of Japan is committed to providing world-class biomedical research for improved healthcare outcomes and capacity development in Ghana and the rest of Africa. He stated that the Japanese government continues to support Ghana's efforts at providing affordable, high-quality universal health care and will continue to partner with the Noguchi Memorial Institute for Medical Research in future training programs and other projects such as technical cooperation on improving quality laboratory management systems.
This is a threat to global health security and has put more and more significant pressure on the need to strengthen our cooperation and establish partnerships so as to build an effective framework to strengthen public health systems. Your continuous participation in these training courses give hope to some regions' capabilities to address public health issues and preparedness to respond to future infectious disease threats. This is consistent with Japan's ODA activities, which has been cooperation aimed at self-reliant development through assistance and collaboration. The government of Japan aims to build the capacity of our partners across key policy domains to be better prepared to handle challenges when they come. Also, this training course is in line with the government of Japan's efforts to promote the concept of human security, of which health is a very key component.
The director of the Noguchi Memorial Institute for Medical Research, Professor Dorothy Yeboamenu, for her part, said the training will help biomedical scientists become more knowledgeable and proficient in infectious disease diagnosis, especially during the outbreak of a pandemic. She added that it would also make them familiar with modern laboratory equipment and foster networking across African nations on advanced laboratory administration.
She has been very much interested in global health, and as an institution we are not only just interested in research, but we are also very much interested in building capacity. We are in an area whereby capacity is quite low and we cannot just be an island, and therefore especially we saw the issue during the Ebola crisis, how so many people died because they didn't have the capacity even to detect. And we at Noguchi has quite elaborate capacity and infrastructure, and therefore with the support of Japan International Cooperation Agency, our objective is to improve across West and Central. Initially it was West Africa, to improve laboratory capacity so that we can improve surveillance for emerging and re-emerging infectious diseases across West Africa. However, as the years went by, we were contacted by colleagues from Central Africa who also require such capacity. And therefore, for the first time this year, it's not only West Africa, it is West and Central Africa. So the main objective is to improve across West and Central Africa the ability to diagnose and detect emerging and re-emerging infectious diseases. Because once we detect, then we could be able to strategize to control the infection.
Some of the participants who benefited from the study of virology, parasitology, and bacteriology, as well as biosafety and laboratory quality management procedures, shared their experience with the news team.
My name is Deborah Effiong from Nigeria. I'm a medical lab scientist and I work in the Nigeria Center for Disease Control, Abuja, Nigeria. I'm here for the third country training on enhancing laboratory diagnosis skills for lab scientists. It has been a worthwhile experience. There's so much I have learned from this training. I have learned, I have unlearned, and I'm relearning a lot of things, My skills have been honed on molecular diagnosis, and I know that going back, I'm going to do great in my institution. Okay, so I had a little idea of what I was going to experience, but I've been exposed to more molecular-based techniques like the LAMP and then the sequencing. But what I knew was just basically real-time PCR, but I've been able to do hands-on conventional PCR and then also the LAMP technique and then the sequencing like I had just said. So going back, I'm going to cascade all that I have learned down to my colleagues, share the knowledge and the experience I have gained with them.
I've been there for the training. The training we start on 8 August, and I'm very happy to be one of the participants because this training allowed me to enhance my skills and knowledge about some area of research and biomedical science as parasitology, bacteriology and virology.
Through the outbreaks we've had before, coming back from Ebola outbreak to COVID-19, we had lots of challenges. Looking at the progress of how medicine is going and in terms of testing, we are now moving to molecular aspects. So we had lots of challenges with molecular aspect. So we are doing conventional training before, but now we have started doing some biomedical, some biological training, biological testing, and I think with the help of this training we can enhance and move forward. Coming from the introductory aspect, which speaks about laboratory standards, I think without observing laboratory standards, the laboratory can't function. Then coming to the other various departments, we have the old techniques which they introduced us to, which we've been using, and going forward to the new techniques, which is the molecular aspects that makes life very easy.